Hi, guys. I'm good. How are you?
Sorry about that technical difficulty there. All right, so let me just introduce you guys really quick to Nicole. So a little backstory. I post a Why Wednesday every week, and it's just people telling us why they want to become a nurse, why, what makes them, what's their why, pretty much. I know if you are in nursing school or if you've gone through nursing school, yay, they can hear us now. If you've gone through nursing school, they talk about your why a lot. So I posted that, and Nicole posted her why. She's going to talk about it, but it touched my heart like unbelievably. All of you guys touch my heart with your whys. They're all so different, and everybody's so specific. But she talks about her why, and I asked her to come and talk about that too. But a little backstory of Nicole. She was born in Montana. What part of Montana? Anybody from Montana here?
I was born in Great Falls, Montana. So if anyone has studied Lewis and Clark and knows about the Great Falls, it was there.
Awesome. So she has a younger brother and sister, correct?
Yes.
Okay. And then she got a degree. Her first degree was in anthropology.
Yes.
And then she took some time off, and she'll talk about this, and then went back and got an associate's degree in nursing, and then a BSN, and then an MSN, and neonatal nurse practitioner, correct?
Yes. Yes.
So she has lots of credentials behind her name. I'm not sure what they all are because there's so many, but Nicole is amazing. And I can't wait for her to talk to you guys all about her journey and what it takes to become a NICU nurse. And if you guys have questions for her, I'm sure she'll answer them for you. So just start putting them in the chat. So Nicole, I'll let you kind of take it over, and let's just go ahead and start with your why here.
Yeah. Hi, guys. I'm Nicole. I've been a nurse just shy of 6 years. That realization hit me yesterday when I was talking to Tammy. Mm-hmm. And I'll give you kind of my story. So my first degree is actually in cultural anthropology. And I graduated college the first time around in 2006. So as a lot of you probably know, right around that time is when we had the big financial collapse and people were losing jobs left and right. And I lost my job. And through that process, I had a lot of soul searching. I found myself not wanting to apply to jobs. I didn't know what I wanted to do. And I had all of these people coming out of the woodwork saying, you should be a nurse. You should be a nurse. You'd be such a great nurse. And I said, no, hard pass, not for me. I'm not smart enough. I don't think I can handle like all the gore, the poop, the blood, the vomit. Like, I just don't think I can do it. Like, no. And I sat down for dinner with a family friend as I was visiting back home in Montana. And she said, no, you should be a nurse. I've been a nurse for 30 years. I have my BSN. These are the reasons why I think you should be a nurse. And for whatever reason, that very short conversation over pizza happened to hit me really hard. And I went back home. I live in the Minneapolis area now, and thought to myself, gosh, can I? So I started applying to schools for prerequisites. And once I finished those, I applied to nursing school. And
how old were you at this time?
I started prerequisites right around when I got married. So I was 25, and about 27, 28 when I started looking seriously at nursing schools.
Okay.
I was waitlisted my first time around, and all of a sudden I got the email saying, you're in. Nice. And I got into nursing school, and I was so excited. I had a huge laundry list of things to get ready in about a 2-week time period. I had a 15-month-old son. Wow. I had been married for 3 years. And one day I was taking a shower, and I found a lump in my breast. I won't pretend that I was doing self-breast exams or anything like that. I literally was washing my body, jumped out of the shower immediately, went to my husband, and there was something in the back of my head that said, you have to check this out. Yes, I'm a nurse now. I don't always love going to the doctor myself.
Right, of course. Nobody does.
I went in to my midwife who had delivered my son just 15 months prior, and I said, could you have a look at this? You examine a lot more breasts than I do. Like, what do you think? And she thought, you're 28 years old. Like, this is probably nothing. It's probably just breastfeeding.
You're 28 years old now.
28.
Wow. Okay.
And she was like, but I don't really want to have any regrets. So let's just send you for an ultrasound. It's pretty inexpensive. It's minimally invasive. Like, let's just figure this out. Like, and then we can all rest easy. Great.
Mm-hmm.
I'll go for an ultrasound. I work in a clinic. I'll walk downstairs. No big deal.
Was this the same day as your exam, or was it like a while later?
1 week later, because I actually told the scheduling department, there's nothing to worry about.
Mm-hmm.
Like, I can wait. It's fine.
Yeah.
So I went down and laid on the exam table. The ultrasound technician had her probe and she put it on my breast and immediately goes, what are you doing today? And I said, well, I'm like wearing scrubs. I work in a clinic. Like,
yeah,
I need to get back to work. And she goes, no, we're going to have you stay for a biopsy. And knowing what I know now, that's probably not the way things should have worked or typically work. And I said, nah, I don't really, don't sign me up for biopsies. That doesn't sound fun. And she said, no, Nicole, you're going to be staying for a biopsy today. I'll bring in the interventional radiologist right away. And I think that was the instance I knew I had cancer. I looked up at this technician who was holding my hand. It's actually a pretty painful procedure. And she had tears streaming down her face. And she kept asking questions like, how old is your son? How long have you been married? So it was one day later on January 22nd, 2013, that I was called back into my midwife's office. And they said, you have cancer. You have breast cancer. And I remember her using technical terms. You have a ductal carcinoma in situ. And I was like, carcinoma? Like, I knew what carcinoma meant. I took medical terminology. And she said, Nicole, that means you have cancer. And immediately I got rushed off to meet with a surgeon, to meet with a plastic surgeon, to meet with oncologists. And it was this whirlwind. And my first response back to her was, but I want to have more babies. And I'm going to go, I have to go to nursing school in a week.
No, wow. So you were about to start nursing school.
Yeah. In 1 week, I was going to start nursing school. And so I sat in that imaging office later that day, waiting for my mammogram. And I was emailing my nursing school and just saying, I'm currently in an imaging department. I was just diagnosed with breast cancer. I can't start in 1 week. And my nursing school was so fabulously supported. They said, take care of yourself. We're going to be here when you're done, and you're going to be a nurse.
Wow, that's amazing.
I thought my life was over. I was 28. I had a 15-month-old, and I had breast cancer. I'd only been married for 3 years, and it was terrifying. So through that, I learned that I had stage IIIa breast cancer. I am BRCA2 positive, so that has high risk for breast cancer, ovarian cancer, pancreatic cancer, colon cancer, melanoma, prostate cancer for men, which we decided it's likely lineage through my father and his mother, which is not typical to pass down through males, but it did.
Yeah.
So after 1 year of multiple surgeries, chemo, radiation, I got to start nursing school.
How many years did you say it was?
1 year, almost.
1 year.
So I was diagnosed January 22nd. I had my final surgery on December 26th, but that fall semester prior, I was back in taking like dosage calculations and pre-nursing program classes.
Wow.
And I started my program February 1st. So almost exactly 1 year. 1 year, 8 days from diagnosis, I started my nursing program.
That's seriously amazing. I was telling Nicole this yesterday, but like her story touched me so much is because I'm watching my sister go through battling breast cancer right now. And you don't really necessarily see that whole year. It's like, it's such a, like, I feel bad saying it because I'm not experiencing it, but just watching somebody experience it, like I had no idea until I had a family member, and it's, you guys are amazing. Like what you go through, like I don't know. And I again, like, you can't, I say, I don't know if I could do it, but then again, I guess if you're put in that situation, like you had no choice, like you had to fight. You had a son, you had a husband, you had family, you had friends, you had people that loved you, and you fought, I would imagine, for them.
Yeah.
Truly inspiring. I believe that's probably John that said that. So
Yeah, I think I always tell people, because they say I couldn't have done it, and I always say you could do it. You could do it if you had to, and I had to. There was no other option. I was 28 years old. There's actually a statistic out there that says that the high majority of breast cancer diagnoses actually don't go back to the workforce. But I think that's actually a little bit skewed, because if you think of the typical woman or men who get breast cancer, it's normally 60 plus. And had I been 60, maybe I got to retire or, spend time traveling or something like that.
Right.
You don't get that luxury at 28 years old.
Right.
You have the luxury of raising your toddler as you're running around with a scarf on your head. You have the luxury of going back to school and having a whole life in front of you. And I think through that process, it's where I learned what kind of nurse that I wanted to be. And not meaning like, oh, I want to do NICU versus oncology versus dermatology or something like that. I learned what it takes to impact a patient and to be on the receiving end of what it's like to be that patient, and what works and what inspires and what gives hope, what gives reality, but what keeps you going as that patient. Right.
We have this phrase that we use at nursing.com all the time. It says, be that nurse. And there's a blog post all written about it, but he's John. He's talking about his experience of really putting yourself in that as that patient and be that nurse how you would want. And I kind of want you to touch on that really quickly, just for those that are kind of in nursing school, about to graduate. Like, what made you put yourself in that experience?
Yeah, when I was accepted into the nursing program, or even when I started those prerequisites, I don't think I knew what a nurse was. I knew, but I didn't know.
Yeah.
And it was my first surgical experience. So I did surgery first and then chemo second. That's not always typical. It's just the way I was filtered through my treatment plan. But it was my first surgical experience. I went in, again, 28 years old, for a double mastectomy. And it was one of the mornings I woke up, and I had learned coming out of anesthesia that it was stage 3 and I was going to have chemo. And that was kind of my worst nightmare. It meant I was a real cancer patient if I had to have chemo. And I woke up and I was crying in my bed and just really tearful and feeling very sorry for myself. And my nurse, Shelly, came in. She was my day nurse through the whole weekend. And she goes, "Why are you crying?" And it wasn't an offensive, stop crying, let's get over this. And I just said, I'm crying because I'm feeling sorry for myself. This really sucks. I'm 28, I have a child, I want to go to nursing school, I want to have more babies. I want for my life because I'm 28.
Right.
And she said, "Okay, you can feel sorry for yourself. We're going to take a minute for that." And she grabbed me by the shoulder. She turned me, helped me up, turned me to the side of the bed. She looked at me and said, "But right now, today, starting right now, you're going to fight. You're going to fight for all of those reasons, because you can want those things, and we're going to get them. And we're going to start today by getting you out of bed, and we're going to go for a walk." And I remember just opening my eyes, literally and figuratively, and being like, oh, I have to fight. That's no one else is going to do it for me, and I'm going to pick it up. And it was from that inspiration that catapulted me through my entire cancer journey. And it met several of those nurses that along the way. I met Caitlin when I was in chemo, and Hallie and Emily and Julie, who knew that on every Friday that when I would come, they would sit me in my favorite chair. They knew that I had my blueberry bagel with plain cream cheese, my Earl Grey creme, rest in peace, Tivana. And then they would get me a bag of pretzels and a warm blanket, and they would sit with me. And a lot of them were my age. They had new babies or year-old babies, so very similar to my son's age. And we would just talk. We would shop talk. It wasn't "Oh my gosh, I'm so sorry you have cancer." It was "Hey, we're here. Let's do this." And this was often while they were pushing the red devil into my veins. And it was so amazing to get that kind of compassionate care. It wasn't that Caitlin was the only person that could get an IV into me before I relinquished to a port, which if you're in oncology, always recommend a port. That's my advice.
There you go. Yeah, absolutely.
But it wasn't it wasn't those skillful things. It wasn't who could assess me to know that I was having an off day or I needed more anti-nausea medication. It was those nurses who sat with me and inspired me to keep going. And it wasn't, they didn't have like quotes on the wall. They didn't need to show me an inspirational book. They just sat with me and reminded me that my life was worth fighting for. And I was the only one that could do it. But they were there to carry me.
Right.
They were there to push me forward when I didn't think I could take another step.
They treated you like a human. Right.
They treated me like a human, not a cancer patient,
right.
like a human, like a 28-year-old woman is who they treated me like. They treated me like a new mom. And I left that experience so excited to start nursing school. And I was telling Tammy yesterday, nursing school had a lot of tears. I cried a lot.
Yeah.
I worked full-time and I went to nursing school full-time.
And you just survived breast cancer.
And I just survived breast cancer.
Like after you finish the treatments, it's not, okay, it's over. You still have residual effects and stuff.
And having that headspace and trying to do nursing school with chemo brain, that's hard. It's hard to read an exam question, read answers, and remember what that question was to answer it. And if any of you are newer nurses who have taken nursing exams or taken NCLEX recently, they're hard exams, right?
Exactly. Nobody ever said those are easy questions.
But most of my tears came from, I want to be a good nurse. I want to be that nurse. I want to be Shelly and Caitlin and Emily and Hallie and Julie. I want to be them. And
you know what's amazing to me is you finished cancer treatment, correct me if I'm wrong, like 2013?
Yes. Yep. So I'm eight and a half years cancer free.
Okay. So 8.5 years later, you still remember those nurses' names.
Yes.
That's amazing.
I remember their faces.
To
this
that's truly a story of they were that nurse. They were.
Yes.
So that's amazing to me.
So that was my why. That held me through nursing school. That carried me. And on those really bad days or that off exam or off quiz, I was like, no. Like, I have the tools that it takes. I can learn this stuff. I can get the grades. I can pass that NCLEX. Keep telling yourself that. Yes. And I can be a nurse. And kind of getting into like where I am now and what a NICU nurse is. How did I get there?
Yeah.
So I graduated with an associate's degree in nursing, and in my community, to work in critical care, you often need a bachelor's degree. I was already in it. I was going to finish it. You can still get a BSN.
Right.
But it was my third semester of nursing school that I realized I really want critical care. Like, it was the heart lecture, the cardiac lecture, and I went into that terrified of cardiology. But it was the first time that an instructor had explained the electrical pump and the physical pump, or the electrical reaction and the physical pump of the heart, that made sense to me. And I went, oh, I get it now.
Yeah.
And I remember coloring in those sheets, learning about all those cardiac lesions, the transposition of the great arteries, tetralogy of Fallot, those big, big lesions, and think, gosh, I want to do this. Like, I want someone fresh out of the uterus to come out with this lesion that I need to figure out, where is my blood flowing? How is my assessment different because of that blood flow change? And my instructor that semester was a NICU nurse. And I remember her talking about the care she provides, the type of detail-orientedness that she provides her patients, the assessment, the holistic family-centered care that she gets to do. And I thought, I want to do that.
Yeah.
Like, it's one of those, like, I don't think you know what nursing is until you start to discover it more. And I don't think I knew that there were NICU nurses. Of course, I knew there was a NICU. My son actually was in a NICU for a couple of days. But I had no clue. And it was through that I was like, I want to be like her. So I set my goal to that. And I couldn't get into the NICU with an associate degree, but I was bound and determined to finish my bachelor's degree of nursing. And so I started working in a pediatric home care company who had the most incredible orientation process. I learned autonomy. I learned how to talk to patients and families. I learned pretty high-level skills, working with trachs, working with home vents, G-tubes, central lines, TPN dependence, doing TPN in the home. We had one kiddo who had some pulmonary hypertension and was getting Remodulin infusions in the home, which typically isn't even approved by insurance. But in pediatric care, it is so imperative to get these kids home. They're going to thrive there.
Right.
So I did that for about 1.5 years while I finished my BSN. And then I applied to the NICU and I got in.
Yay.
And it was so great. I was telling Tammy, I wanted the big NICU. We have about 4 NICUs here in the Twin Cities that are at that level 3, level 4, but I wanted to do it all. So I'm in a NICU that's an academic level 4. We're a regional perinatal center. We do ECMO, dialysis, transport. We're a delivery center. And I love it.
That's amazing. Can I just pause really quick?
Yes.
I want everybody who is trying to get into nursing school or who maybe doesn't feel they're having that little bit of that imposter syndrome. Remember, Nicole was waitlisted before, and now she's working at a level 4 NICU. Like, that's, so don't give up. Like, if this is your why, if this is your dream, like, keep fighting, right, Nicole? Like,
yes. It was just playing before the live. Someone talking about she tried 6 years to get into nursing school. 6. Are you kidding me? Like 6 years for a 2-year program? Like that's bananas.
That's Ellie. She's amazing. So
so great. Like keep going. Don't stop, because everybody's going to have those A's in the prerequisites. We all know that. Like that's how you're getting into nursing schools, A's and B's and trying to get in. But keep going, volunteer, find different ways that you can up your research or up your interview games so that you can get into those programs. They'll take you. Yeah. You can still be a good nurse, even if they tell you no 5 times before they say yes.
Yeah, clearly. Look at you right now. All right. Sorry. Okay. So you were working home health while you finished your bachelor's. Now you just got into level 4, the biggest NICU hospital in the Twin Cities. Then what?
Yeah, so I got in and I was terrified. Like these babies were very small, you guys, very small. So
you had a bit of imposter syndrome too, or
my gosh, I remember my first day, and I still remember the bed spot. I obviously remember my preceptor that day. She still works there, and it's so great. But we had just this 34-weeker on-room air, and I literally was like, "How do I touch this baby? Like, what do I do?" And now I'm like, "Oh, 34-weeker, no big deal." Right. But it went from like not knowing how to even reposition this little human to helping resuscitate 22-week gestation babies, taking care of an ECMO patient, running peritoneal dialysis. In the NICU, often you do manual PD, so it's not on a pump. They're too small. The volumes are too little. So you have to sit there and count every little millimeter or milliliter that you're putting in there. And I think what I love about NICU nursing, yes, it's very detail oriented. I will be the first to say I'm super type A. You're dealing with hundreds of a milliliter. You'll drop morphine or fentanyl dosage that like you can barely even see in the syringe, but that matters. It matters every mil that you flush that IV with, because you don't want to fluid overload a 350 gram baby who is the size of a pop can. It's crazy. Like, how small and how detailed you have to be. But I love that you are working in this little 5x5 area with an isolette, with equipment that encompasses the whole room full of pumps and drips and vents, and you're working collaboratively with the RT. These doctors and nurse practitioners are trusting your fine-tuned assessments, your gut instincts of, I looked at this baby 4 hours ago and the belly is a little bit different. Do we need an x-ray? Do we need to be concerned about perforation or necrotizing enterocolitis? This baby's temp is elevated like 0.5 degree. What are we going to do? We need a sepsis eval. My secretions are a little bit more yellow. You need that detailed orientedness, but you get to turn around and you get to educate these families. And I think one of the best things in the NICU, there's probably top 3. Letting a parent hold their baby for the very first time.
Oh yeah, I bet.
Every single time I cry. Letting a parent feed their baby for the very first time. And that might be having them push a syringe of 1 ml of milk into that baby's belly. And letting a parent change the diaper for the very first time. And reminding them that typically these babies come home with less equipment or no equipment.
Right.
You need some very good communication skills to work in a NICU. Knowing those boundaries of communication of how to talk to these families, providing hope, but not providing unrealistic expectations. And I think my example of that was my very first primary. She was a 24-weeker, still on high frequency ventilation past 30 weeks, which that's not typical. We want to see progression in their ventilation status so we can start working on feeds by like 34 to 36 weeks. And I told the parents, like, oh, don't worry, you're changing that diaper. When you go home, you won't have any cords and tubes. And I stopped and went, ooh.
Yeah.
Baby might go home with a trach, with a vent, with a pulse ox, with a G-tube. Like, there's so many things that might happen. And it was from that moment forward that I was like, okay, we got to fine tune this communication. We have to set realistic expectations, provide hope, but we can't oversell, because parents hold on to those words. They hold on to those words, those numbers, those dates. And you got to make sure that you're setting them up for success.
Exactly. So if somebody were to, if somebody's dream is to like work in the NICU, what are 3 things that you would suggest them doing? They're in nursing school right now, or they're going to be in nursing school. What are some of the things that you would suggest doing?
Yeah, I think if your nursing program offers a pediatric rotation of some sort or an elective, jump on that for sure. Pediatrics as a whole is so different than the adult world, but NICU is even so different from peds.
Yeah.
In that same sentence, trying to find someone to shadow. Do they offer a day for you to go shadow the NICU? Jump on that opportunity. Get in there. Go see it. It's a different ball of wax when you get there.
Right.
Start studying up on those fetal to extrauterine type phenomenons. What is it like for a baby to transition from fetal circulation to extrauterine circulation? Start studying your cardiac heart lesions. You're going to see a lot of those and need to know those for your heart assessments. Really focus on your fluid and electrolytes. They're hard, guys. They're so hard, but there's great resources out there for you to figure it out, and just study and study and study those. And then just in all of your clinical practices, work on your communication. It's hard. It's hard to talk to people, but work on it and get those fine nuances. Understand the weight of your words. Like I was mentioning, saying, oh, I can't wait for you to go home. Well, what if that patient's probably going to die? You shouldn't say those words. Right. So really being mindful of how you speak, getting feedback from your clinical preceptors, or if you're in a unit currently, getting feedback from your coworkers and your colleagues of, did that sound right? Should I have said that differently?
Right.
And to kind of give a few more tips, if you're wanting to really fine tune assessments, there's YouTube videos out there to listen to like different lung sounds, different heart sounds, especially in neonates. It's hard when their heart's 140 to 160.
Definitely. So here's the nursing.com plug.
Yeah.
Because we weren't around when you were in nursing school.
No, they weren't. I wish you were.
Right. So we actually have, 2 things that she mentioned, actually all 3 things, we actually have lessons on all of those. So if you have your nursing.com account, go check out the fluid and electrolyte course. That course is amazing. Second thing, we have communication for nurses. We have that course. I'll put links to all of these, but it talks about S-bar communication, which is something that you were talking about yesterday, right, Nicole? Yes. And then we also have heart and lung sounds. Like we actually have audio where you can actually listen to different what's the word? Help me out. Different rhythms and stuff. So we actually have all that stuff. So I'm going to put links to those. So if you have your nursing.com account, go check those out. So I have a couple questions for you from some people. Paris would like to know, how did you become comfortable with communicating with parents, doctors, nurses, and nurse practitioners?
Yeah. Hey, Paris, how are you? I'm not shy, so I think that's a little bit of a difference. But one thing I did mention to Tammy yesterday, especially when talking to providers, because NICU, yes, there is the hierarchy of medicine. You have your nurses, your nurse practitioners or PAs, you have medical residents, fellows, and then attending neonatologists. You also have respiratory therapists, you have dietary. We're all working within our specialties to be really collaborative. And I think going back to nursing basics, what is the best way to communicate? And that's in an SBAR. So situation, background, assessment, and recommendation. So when you are presenting something to any of those people, using that format to be assertive, to be clear, but it's also a language that they're going to understand. And when you start to speak that way, they're going to perk up and listen to you and go, oh, she has something she wants to talk about and wants to really advocate for her baby. So saying like, hey, I've had this baby all weekend. I've really gotten to know him. Former 24 weeker. We've been kind of going up on feeds. We recently just fortified. I'm noticing that the belly is a little bit more distended, a little more firm to touch and palpation. I'm not hearing quite as many bowel sounds. And the belly might be a little bit loopy or dusky in that right upper quadrant. Is there any way that we could get an x-ray? Or can you please come to the bedside and have a look? So there's an SBAR. It sounds like casual conversation, but starting to form your communication in that way that's going to be effective with all of those people.
Yeah.
When talking to parents, I think, SBAR is not going to speak to them as much. I think just being real. One thing I was telling Tammy that home care taught me was how to give parents privacy. It's okay to step away. And I think, especially being an upper Midwest gal, we're all about Minnesota nice, the long goodbyes. It's okay to step away. It's okay to be like, hey, I'm going to give you some private time with baby right now. I'm going to be right over there. My roommate's name is Ashley. Holler to either of us if you need anything. Just giving them that space, giving them that autonomy, the space, the confidence to be parents. Help them with what they need help with, but don't overstep. Let them be the mom and dad and reassure them that you know most about your baby. Even if I'm the nurse caring, you still have that mom and dad instinct. That baby still knows your voice. Talk to them and talk for them. And be sure to give them that space so that they do feel confident speaking up for that baby.
Oh, that's amazing. So I put a link to the SBAR communication lesson. So you guys go check that out. That's once you get it down, like it takes a little bit because it is kind of weird in the beginning, but like once you kind of get it down, it just becomes natural communication kind of. And then I saw myself talking like that to like my friends and family. I'm like, oh God, this is like, they're like, stop talking like that. Okay, so Nikila Price, I don't know how to say your first name. I am so sorry, but I am so encouraged by your story. Thank you for sharing. I would like to ask, what would be the best way to experience working with neonates?
Yeah, I think NICU's hard. I think if you are in a nursing program right now, it would be beneficial to see if your hospital offers any volunteer opportunities in the NICU. I'm sure a lot of you have seen like the baby holders on social media. That's a thing. Like we actually do have people volunteer to come rock babies that the nurses aren't available to just hold, whose parents aren't available to hold. Volunteering in the time of COVID can be a little bit challenging, but still check it out. If you can get a nursing assistant job in a NICU, that would be a way to get your foot in the door also. Nursing assistants in a NICU will often help with baths, weights, heating up milk, helping the nurses stock carts, maybe writing down vitals if the nurse is really busy. So there's still opportunity in the NICU. If you're already a nurse and want to get into the NICU, honestly, any nursing experience is going to be valuable on that application. I think my path is a little bit unique. Minnesota does have a really great home care program. I know other states aren't that fortunate to have a solid home care opportunity, but I thought getting into home care would serve me a little bit better because those are direct NICU skills. The kids coming into pediatric home care are going to be from a NICU or from a PICU. Like I said, often with a trach, vent, central line, TPN, those are NICU skills. So those are very transferable from home care. Don't ever negate home care nurses. It's a hard thing. They do all of the jobs from being the nurse to being the housekeeper.
Yeah.
So it's going to teach you autonomy and a ton of skill and communication, especially. Other areas, I think any pediatric area would serve you well. And I know some float teams have critical care float teams that'll get you into the NICU to hopefully get your foot in the door.
Oh, that's awesome. So I know, okay, so we kind of stopped because now, when did you finish because you just recently finished up something. What was that?
So I, COVID was wild enough, like, let's go to grad school.
Right, of course.
I did an accelerated 1-year program with Vanderbilt University to become a Master of Science in Nursing, neonatal nurse practitioner. So officially, I am now Nicole, MSN, APRN, NNP. Once I take my boards, I'll have the -BC for board certified on there. So once you work in a NICU for 2 years and 2,000 hours, you can have the opportunity to do your RNC NIC certification, so Registered Nurse Certified Neonatal Intensive Care. I actually don't have that. It was kind of one of those things, I'm either going to do that or just go back to school, and I went back to school. Those same qualifications will allow you to apply for an NNP program, Neonatal Nurse Practitioner program. So that's what I did. Those are the providers in the NICU who are specifically NICU trained. Our scope is 0 to 2. We work on managing the patients in the, with the supervision of the attending neonatologist. But we're also the ones doing most of the skills. So intubating, placing PICC lines, lumbar punctures, bladder taps, chest tubes. We're the one manning the head of the bed at critical deliveries.
Wow. And Nicole, you're pretty impressive.
Oh gosh, no. I work hard. But I'm so excited for this opportunity. I think I knew in nursing school I would do advanced practice, but I'm even so much more happy to be like focused on the NICU. It's really focused, but it's so great.
Yeah. So we have another question for you.
Oh, yeah, good.
Heather, I'm currently in RN school. My question is, what do you recommend for gaining confidence for patient care on clinical days?
That's such a good question. I would always get so nervous before clinical, and I was a night and weekend student. And so typically on the weekends, they would have a 90s flashback on the radio that would pump me up for clinical. So I think find your playlist to go there. I know that sounds silly, but find something that's going to pump you up. You need a minute to dance in the car and get those jitters out. But finding confidence, I think just studying up on the area that you're going to. Are you going to peds? Pull out your peds resource book. Go through some practice questions. Go through some rationales. If you're going to a med-surg floor, get your med-surg stuff out. Start learning, what does this medical surgical unit do? The one that I was on happened to be a lot of spine surgeries and a lot of general medicine and some urology. So I read up a lot on like spine post-op stuff, urology post-op stuff. I went in the winter, so it was like a lot of pneumonia and things like that. Always have a book for resources for like your medications. As a nurse, you should always know why you're giving your medication, along with doing your 5 rights, or I think there's more rights now. But making sure that you're going through those, but why. Why are you giving that med? Was it a med they're on at home? Doesn't matter. Why are they getting it? Because a lot of patients don't even know. And they'll, maybe the pill looks different in the hospital, and you can be like, actually, this is your Lasix, and this is why you're getting it. So having that information. But I think the biggest thing to gain confidence, ask questions. Nursing as a profession is a giant serving of humble pie. You don't have to know everything. There is always a resource. But one of those resources, it's yourself and your ability to ask questions. Stop your preceptor, stop your clinical faculty, stop another nursing student, be like, hey, can we talk this through? Because the best way to learn something is to see one, do one, teach one. And the minute that you can start to teach it back, you're going to know so much more. So just using those resources, and don't be afraid to ask questions. You're actually going to be able to get a better rapport by being the one to ask questions. Absolutely.
There's no dumb question, right?
No, there's not. There's not. And even if it is silly, it's not dumb, because if you don't know it and you need to, you still need to ask that question.
Exactly. I love that so much, because you'd rather, me personally, I'd rather ask that dumb question than do a mistake and then cause even more. So is there anything else that you think that, I do want to add that we do have a cheat sheet for you guys for like medication and stuff. So I'm going to put that link in there. For some reason, it's not letting me put the links to these things in the chat. So after the live, I'll add all the links so you guys can go check them all out. All right. So what else would you say that somebody would need to know? Heather said, thank you so much. Great advice.
Thanks, Heather. Know that nursing is hard. I had the opportunity of giving kind of the class address at my ADN graduation. And I remember saying, nursing is really, really hard. Because literally our thought process and our critical thinking could mean life or death. And that's where this goes back to asking questions that you don't know, speaking up when you think an assessment is worth having someone else to have a look at. Holding that knowledge is so, so powerful. You are entering the most trusted profession in the United States for so many years. Keep it that way. It's hard. It is so hard. You're going to have bad days. You're going to come home and cry. Find your people. Find those people. I mean, yes, I have my husband. I have my best friend who lives next door, Jill. I have my best friend at work, Mandy, who precepted me in the NICU, who I still to this day call her crying and go, what am I doing? What is happening? And not every day is like that. It's okay to have a patient impact you so much that you question yourself, because you know that you're just going to do better for the next one.
Absolutely.
And nursing is forever learning. Those resources, gain your certifications. Not everybody has to do advanced practice, but you do need to continue your education. Yes, it's required for our licensure, but do it for your patients, do it for the babies, do it for those parents who are going to walk in and ask questions. That's what's most important. Keep learning, keep growing, and you can do this. I promise. Anybody can do this. You just have to want to.
Exactly, right? You have to have that want and that. Yeah, I love that how you said find your people that you can talk to. I remember like I'd be driving home, like being called in for surgery or emergency surgery or something. And like that case really impacted me. And luckily, like I'd be driving home and my brother is actually a nurse. And so I would call him up and I would be like, hey, this is just what happened. And like, it was just good just to talk about it with somebody else, like that understood like the whole like hospital settings, you know, like.
Yeah. And I always preface my conversations with my husband, like, I know you don't get it, but could you just pretend for like 5 minutes?
Exactly.
And sometimes he'll be like, I don't get it, but that sounds rough. Like, and that's just enough to like get it out and be like, you know what, I had this really bad day. Things escalated quickly. My baby passed away and I'm sad about it. I'm sad. I'm sad for this family. I'm sad. I'm sad for me. I'm sad for the medical team, because in the NICU, you can do everything right and that baby still might not live. And I think that's hard as someone who is a perfectionist and type A. But again, stepping back and going, debriefing, could we have done anything differently? Did we do all the right things? And just talking about it with your colleagues, your family, HIPAA compliant, of course.
Right, of course.
But just having those people to be your sounding board. You don't have to carry it at all.
Right.
We're a selfless profession, and you know, you're not going to walk out every day and have someone tell you thank you. But knowing enough to be like, okay, I'm just going to do better tomorrow. Get back on that horse.
Yep, absolutely. Okay, somebody says, do you have any suggestions for someone who wants to start a NICU as a new grad?
Yeah. New grad NICUs are hard. So you don't always have to enter that level 4 right away. That can always be your goal. Sometimes getting in as a new grad to like a level 2 NICU. So that's typically a NICU, like a special care nursery. So babies who need a little bit more monitoring, up to like babies who need some CPAP. or a little bit of respiratory support, glucose babies, late-term preemie babies that just aren't the right gestation to go home yet. Those are often easier to get into as a new grad. If you're in like a traditional BSN program that offers like a capstone and you get to pick your specialty, pick NICU. They'll often pick you back.
Yeah.
So do that and get your name in the door, network, get your resume out, talk to your preceptor. If they're a preceptor, they're likely influential within their unit. So talk to them. Hey, this is my goal. This is what I want to do. How can I work here? Do you have any tips? If you can't work there, is there another hospital within the hospital system that you could work at? But just keep applying. Don't give up. Don't give up at all. And like I said before, trying to find volunteer opportunities or even just working in that hospital system will often get your NICU application pushed ahead.
Absolutely. Wouldn't you say take your clinical days as a job interview every day?
Absolutely. Every single day. They're watching you.
Absolutely.
Even in RN school, I had so many people come and go, do you want to work here? We'd love to have you. Like they're watching. They know. And as someone who does precept a lot of new grad nurses or just new NICU nurses, we know instantly who's going to cut it. We know.
Yeah, absolutely. All right, Nicole, I asked you, do you have any pictures or anything like that?
I do. Okay.
I asked her, so I was like, make sure they're like HIPAA compliant and stuff. So let's see.
So here's me. My husband actually suggested that I take pictures while I was bald. Losing my hair was so hard, but I've gotten such great compliments on these photos, and I'm so happy I have them documented. I think it shows strength and beauty, which is not something that I say out loud often, but it's crazy to look back. So there's me. This was just a couple years ago. This is just my son, but you'll notice his shirt says "My Mom Won." My favorite, so I just had to include that. We were at a rodeo in eastern Montana.
Oh, that's awesome.
Tough enough to wear pink night when we donate to breast cancer. Here is my associate degree pinning. Sorry, there's a little bit of a glare.
Oh no, it's fine. Yeah.
So there's my husband pinning me. I was so excited. I graduated in December and they had it just so beautifully decorated.
That's amazing.
Here's us again at pinning. That's my husband. Fun fact, I had like the norovirus like 48 hours before. So so here I didn't have a lot of like inside the NICU pictures. My company has a really strict social media policy, but so always be wary of that. Be careful what you post on social media. But I'm on the transport team. So we have opportunity to fly rotor. So this was my experience.
That's so cool. That is
like,
so cool. I did not know you were on the transport team.
Yeah.
Now that's pretty cool. I've always wanted to do like be a flight nurse and stuff like that.
So I have a slight obsession with like airplanes and stuff. Yeah. So I wanted to be a fighter pilot when I was little.
Oh wow.
But yeah, so we kind of regionally, we go into North Dakota, Minnesota, ground, fixed wing, and rotor, and we pick up babies. So a lot of these babies are unknown cardiac defects or surgical babies like duodenal atresias, volvulus, stuff like that. So that was my opportunity to go in the helicopter. It's so cool.
That's really cool.
And then fixed wing opportunity.
Wow.
That transport isolate is 500 pounds, and we have to manually lift it into our air vessel. So that's hard. But again, so amazing we get that opportunity.
Yeah.
And oh gosh, I'm dropping these left and right.
Look at that.
Here's my little family.
That's so awesome.
This was at Vanderbilt University just about a week and a half ago when I graduated. You'll see my pin. You guys go to pinning ceremony. It's magical. And I mean, super nerd here, but it goes all the way back to Florence Nightingale. Like earning that pin that is specific to that school is so honorable. It's amazing. Awesome. So yeah, there's
so cool. Thank you for sharing those.
Yeah, of course.
So Nicole, is there anything else that you would feel like people would want to know or need to know about NICU nursing?
I mean, I think the biggest thing is is find your people, find your people, love them hard, and let them love you back. Like I said, we live in such a thankless profession that is yet so honorable, especially in the times of these pandemic. All the things happening with COVID, and hats off to you guys that are trudging through school in such an unconventional way. If you want to be a NICU nurse, keep at it. Keep at it. It's a competitive field to get into, especially these higher acuity type units. But know that you can start in a level 2 and then work your way up to a level 3, and then maybe one day get into that level 4, which is a more regional center. You have opportunities to attend deliveries and offer resuscitation. You have opportunities to go on transport. You have opportunities to work with surgical procedures at the bedside. NICU is so unique and special, and you are caring for the most tiny humans, the most fragile humans who have literally just left the womb, but you are holding someone's life in your hands because they're not small.
Yeah.
Keep doing it. Keep doing it. Keep loving it. Keep loving on the babies. But love on yourself. Love on yourself first, so that you can provide that for them.
Awesome. Nicole, I think you're really amazing.
Thank you.
I think you've overcome some really challenging times, and you didn't let that define you through chemo, radiation, surgeries, everything. And you still went after your dream. You remembered why you wanted to do it in the first place. And I can tell that you are an amazing nurse, and you are that nurse, or be that nurse. You are that person for sure.
Yeah. Thank you.
Yes. But I want to thank you so much for coming and talking to everybody today. We want to have you back anytime that you want. So, but I hope you have a great week. Thank you, everybody, for joining us today. And if you have other questions for Nicole, send them to me, and I'll reach out to her, and we'll answer those for you guys. But if not, have a great weekend. I'll put those links to those resources that Nicole had mentioned, so you can go check out your account and get those resources for you. But have a great day, and we will talk to you soon. Bye, everybody.
Bye, guys. Thank you.
Do-do-do.